The third, fourth, and sixth cranial nerves are responsible for eye movements. In patients with a third cranial nerve palsy, the affected eye is fixed inferiorly and laterally at rest, and it cannot be adducted. In patients with a fourth cranial nerve palsy, the affected eye is turned superiorly and laterally, and it moves even more superiorly with adduction. In patients with a sixth cranial nerve palsy, the affected eye is fixed medially, and it cannot be abducted. To test the function of these nerves, begin by performing a gross examination of the eyes and eyelids to look for any asymmetry or involuntary movements. Next, ask the patient to keep the head still and track your finger. Move your finger to all four quadrants of the visual field, following an H pattern. Also, move your finger toward the tip of the patient's nose and look for convergence and pupillary constriction. Abnormal or asymmetric movements may indicate a palsy, which would require further testing with the alternate cover or red glass test or a consult with a neuro-ophthalmologist. Then, dim the lights in the room and ask the patient to focus on an object that is about 10 to 15 feet away. Shine a light into the patient's eyes, one eye at a time, and observe the pupillary response. The pupil should constrict, and a concentric response in the other pupil should be observed. A swinging flashlight test can be performed at this time. Shine a light directly into the patient's eye for 2 to 3 seconds. Then, swing the light into the other eye for the same amount of time. In a normal response, both pupils will constrict equally when the light is shown in either eye. Abnormal pupillary dilation or a delayed response could be indicative of a relative afferent